Hello guys, welcome back to the channel. I'm starting something new where I'm going to have possibly weekly, maybe more if I can get it in, autopsy report reviewing. And I'm starting with Matthew Perry, just a little over a couple of months out. And so I'm doing this one first. This is per the banner, no disrespect toward the decedent nor to their families, but just to help non-medical and possibly even some medical people understand what the importance of an autopsy report is and the information that you can get from it. It is very, very invaluable in such that it can help even those in the medical field learn a lot of things. And the information that it's in it, while some things may come out, there are some details that people overlook just because they don't understand what it is they're reading. So if you are new to the channel, welcome. Please hit the subscribe button. Please comment and engage. Please feel free to send in reports or things that you would like for me to discuss on the channel. If you have an autopsy report that you would like for me to analyze, it doesn't have to be a celebrity. We will cover others as well. Put it on the community tab, put it in the comments, send me information. It should be in the description. I'm learning how to put things there. Speaking of description, I'm going to tag some videos of things that I'm going to mention about his autopsy, videos that are related for you to also watch so that you can learn as well. And hit the like button. If you don't like it, hit the dislike button, but just engage, share the video, and we're going to get started. And I did a little kind of long intro for about 2 minutes because that just helps me with the algorithm for YouTube. Okay, so let's get started. We don't want this to be over 20 minutes. So just looking at the autopsy report, the Department of Medical Examiner, the autopsy was performed in Los Angeles, California, on October 29, 2023 at 9:30 a.m. From the anatomic findings and pertinent history is ascribed the death, per the medical examiner, to acute effects of ketamine. Now, what exactly is ketamine and what are the acute effects that they're speaking of? Just a little background history, as many of you probably already know. Ketamine is an anesthetic that is used, injected to produce deep sleep. It was developed back in 1963 as an animal tranquilizer. A lot of people ask about that, to replace PCP. It's mostly used in animals, but it has been used in humans, I believe, since the late 80s or somewhere in the 80s. And we use it in surgeries. We use it for pain management, and it's also used in depression. Ketamine infusions are very widely used among celebrities. On the street, in the pharmaceutical arena, a street pharmaceutical arena, it is known as Special K. And when you have it on the street, we call it rogue ketamine. Like I said, it's called Special K as well. But generally, that ketamine usually has been swiped from veterinary offices. When we talk about the acute effects of ketamine, we are just looking at the effects that it has. It obviously causes pain relief, but it also causes, or can cause, hallucinations, a change in the blood pressure. That means it could decrease your blood pressure as well as increase your heart pressure, your blood pressure. And when abused, it definitely can give you out of body experiences. However, it is an anesthetic that causes dissociative effects because it works on the NMDA receptor in the body, and the NMDA receptor is for learning and memory. So when we give this, generally in the extremes of age, children, adolescents, elderly, perhaps when they come in and they're in severe pain or they have to go through a procedure and they're just kind of anxious and they're hurting, we give this to them. And I'm saying more so in the emergency room, we may give this to them or give this into a procedure that way we're doing because, like I said, it blocks the memory and they're able to dissociate. And so they don't remember such a traumatic event that they're experiencing, okay? It also can cause delirium, dizziness, euphoria, which is a feel-good feeling of like, oh, the world is, everything's great in my life. On the flip side of that, it can cause nightmares or vivid dreams. When we say vivid dreams, we mean streaming in color. It can cause negative delusions, but it also can cause positive illusions. Impaired judgment, increase or decrease, as we stated, heart rate, high blood pressure, nausea or vomiting. Let me correct that. Increased heart rate, but a decrease or increase, sorry about that. Blood pressure, nausea and vomiting, cognitive impairment, memory problems, the inability to see, and the inability to talk, which I'm going to discuss how that is very important in Matthew Perry's case, and fatigue and loss of consciousness. All of these are very important when it says the acute effects of ketamine. Note, no other consequence or cause of death is given, just the acute effects of ketamine. Other conditions that contributed but not related to the immediate cause of death: drowning, coronary artery disease, and buprenorphine effects. Drowning, in this case, water drowning, is the suffocation by submersion of the mouth and the nose in a liquid. Coronary artery disease basically is a narrowing of blood vessels that decrease the blood flow, which subsequently will decrease the amount of oxygen that we get to the body. And buprenorphine, also called Subutex or Subutex, is an opioid like a medication, and is used to treat pain as well as the addiction opioid use disorder. It also is given to people that are addicted to pain. And what are the side effects of buprenorphine? Buprenorphine is a narcotic. The most important effect that I am going to discuss and say right now and related to this is that buprenorphine is an opioid. So it can cause drowsiness. That's why you take it. It relieves your pain. And usually when people take narcotics or pain medication, they can relax, they can go to sleep, they can work, whatever, because they're not focused on the pain goes away, they're able to relax. So I'm going to say the relaxing mechanism. And generally it does that by decreasing your heart rate, which leads to a decrease in your respiratory breaths, so you don't breathe as much and you can relax and generally fall on to sleep, right? When used correctly. The manner of death is accident, which means it is not an intentional death. Person was not trying to kill themselves. And how the injury occurred is unknown. Route of drug intake, ketamine is injectable, but we don't know because on the street, it's generally done different ways. And based on what I'm going to reveal later on in the autopsy, we know that it was more likely what we would call rogue ketamine, that he probably got it from somewhere else, like off of the street. And so the way that he used it, we're not quite sure, because generally ketamine off of the street It could be snorted. It could be put into something you drink because it is odorless and tasteless. And he was found in a residential pool. So when we look at the anatomic summary, 54-year-old male with a history of chronic obstructive pulmonary disease or emphysema, diabetes, drug use in past reportedly clean for 19 months, heavy tobacco user for many years but currently not smoking, on ketamine infusion with most recent therapy reportedly 1.5 weeks before death. So chronic obstructive pulmonary disease, we call COPD, and also emphysema, is basically a respiratory disease. That's emphysema is definitely from his history of smoking, right? And basically he's not able to breathe efficiently, as those of us that do not have it. And so his respiratory system is immunocompromised in that, or immunocompetent, in the sense that he's not, these people are not able to necessarily get as much air out. And so they tend to have kind of a buildup of air as they're struggling. And then you may see them, they tend to have kind of like a barrel looking chest, right? Diabetes, many of you know what diabetes is. No cure for it. His history of drug use in the past. Okay, we're not going to repeat all that. He has supposedly stopped smoking, but I believe I read somewhere that he doesn't smoke tobacco. I don't know if he, well, I'm not even going to say that, but it says he stopped smoking. Okay, we'll keep it moving like that. Ketamine infusion therapy, most recently, reportedly 1.5 weeks before death. I'm not really well versed in ketamine infusion, but I believe that is done over several weeks, and I believe you start out at like 2 or 3 weeks as to wean a person off of either their addiction or in the treatment of depression. And that they start off, I believe, at like 2 or 3 times per week, and then they go down into once a week until it's over. So if he had it 1.5 weeks ago, either he is non-compliant or he's nearing coming off of the ketamine infusions. Found unresponsive, floating face down and heated in the pool. That is very important. And I'm going to say at the analysis at the end, but being in a heated water source has an effect on the body as well. And when the medical examiner is saying those are contributing effects, when we get in a heated water source, when we get in a tub that's heated water source, generally many of us are getting in there, when I say soaking or relaxing, we get in there to relax, right? And what does that do to our body? Water, warm water tends to relax our body. It causes what we know is to just make us feel just relaxed. And sometimes people say, oh, I fell asleep in the water. It was so relaxing. It was so cool. So remember that it relaxes you, kind of like the buprenorphine effects, right? It relaxes you and causes you to be drowsy. These are effects. Think about them. And now they're beginning to be additive. Prescription medications and loose pills were present at the residence. However, none reported near pool, and no medications, drugs, or drug paraphernalia adjacent to the pool. No signs of fatal trauma and no foul play suspected. The prescription medications, as we'll address later on, were found and attributed to him. And we'll go through those. And the loose pills, to me, when I'm looking at that, is loose pills laying around. I understand that he did not have any children, so possibly no children there, and possibly, I'm so sorry, guys. Hold on. About that. Moving on, because I think I'm going a little too slow. I I'm just going to go ahead to the autopsy findings. Autopsy findings: focal, moderately severe left anterior descending coronary artery atherosclerosis with proximal to mid portions ranging from 50 to 75% narrowing. Basically, it's really just saying that coronary artery disease is important. It's present 50 to 75%. It's kind of, if you would think, operator dependent that we're looking at and say, oh, I think it's about 50 to 75%. It's nothing really concrete, but there's nothing really going on there that says that it contributed to as far as heart attack or anything. It says no acute myocardial infarctions, which is a heart attack, grossly identified. Mild cardiomegaly is basically the heart is a little large. Lungs with, this little thing is in the way, guys. Lungs with marked anthracosis and bullous changes. The bullous changes are basically seen in emphysema. Marked anthracosis is interesting. It's kind of rare, but it's usually what we would attribute to people that live in high air pollution areas and like coal miners' lungs that are exposed to a lot of coal and tar. It's not necessarily related to the smoking, as well as pulmonary edema and congestion. Nephrosclerosis of the kidneys. This could very much be related to his diabetes, definitely related to uncontrolled diabetes. We're not really sure. Pancreatic fibrosis, which is chronic. This is probably more or less related to his smoking. Remote abdominal surgery with chronic fibrous adhesions of intestines and mostly fluid contents in the stomach. So a remote in the past abdominal surgery, I think I remember him saying that with his drug abuse that his colon almost exploded. So that could be the surgery they're talking about. Anytime you have any type of surgeries or a cut, you develop scar tissue and or adhesions. And because they're around the intestines, I'm assuming that's probably what that surgery is from. Moderately severe aortic atherosclerosis we talked about. That's coronary artery disease. And one thing about coronary artery disease, if you see it in one place, you probably see it in other places as well. Chronic hepatic congestion, liver, mild splenomegaly. This could be related to heart disease as well. See separate microscopic toxicology and microbiology reports. Going down in the external examination of the body is identified by toe tags, and it's that of an uninvolved refrigerated adult male who appears to report an age of 54, which is great. He appears his age. Body measures 70 inches and weighs 216 pounds. Remember his weight. And is normally developed, mildly obese with a body mass index of 31. Nutritional status is unremarkable. Skin shows no evidence of jaundice, which is great. We look for jaundice generally in liver failure, alcohol abuse, whatever. Mild immersion, wrinkling of the hands and feet is noted. I attribute that to him being in the water, at least more than probably 20 minutes. That's why we say in the water, 5 to 15, 20 minutes tops, get out the water when your skin starts wrinkling. Yellowing of the right end, early clubbing changes of nail beds are noted. There are lots of things that can cause nail clubbing. His is probably attributed to smoking. However, video linked in the description. Yellowing of the right index nail is seen. I think some people might think that's odd, but he has a history of smoking and video linked. I would assume this may, in his case, be to possibly, because it's his right index finger, is where he holds his cigarette, and the tar from the cigarette, or when he's smoking, whatever he's smoking, is getting on the nail bed and yellowing it. Don't hold me to it. Scars, several abdominal scars, a back scar, nonlinear, bilateral forearm scars are noted. No identified tattoos. Rigor mortis is moderate. Liver mortis is blanching and posterior. Head is normal in size and shape. Scalp is gray-brown. no temporal or vertex balding, mustache is present, short goatee with facial stubble, full beard is absent. Examination of the eyes reveals iris that appear to be blue and sclera that are congested. And some of this you just see when a victim is passing. Congestion is very prominent. Transparent lens membrane of the right eye covers the iris. The conjunctiva are mildly congested. Oral nasal passages are unobstructed. There is no foam in the nostrils or oral cavity. This is very important because generally when we see foam, it could be indicative of an overdose. Upper and lower teeth are present with excellent dentition. I think this is very important to mention because I remember on his friend's reunion, people were like, oh, well, his speech is slurred, his face is dull, and he's talking like this. But I believe they said he had came from a dental appointment. And so it's good to know. Excellent dentition is great. Frenula and oral mucosa are intact. There is no chest deformity, mild to moderately increased anterior posterior diameter of the chest, and that's basically that when I spoke about chronic obstructive pulmonary disease, COPD, they tend to have a barrel-like chest, so the AP diameter is what they're talking about. That's increased, so that's what they're describing there. The abdomen is mildly obese, and he's status post-remote surgery. Genitalia are those of an adult male. External genitalia are without trauma or lesions. There is no evidence of recent therapeutic intervention, and there's no recent distinct needle punctures that are identified. This is very important. And so this is why when they say they don't not quite know the route of the ketamine, there's no needle punctures that they could see that could possibly be the source. There has not been postmortem intervention for organ procurement. Postmortem changes, there is evidence of postmortem changes consisting of anterior activity with abrasions, appearing red-brown on the face due to discovery being prone face positioning, yellow-brown on hips, thighs, and upper extremities. Tardive spots present in a few areas of the back. Tardive spots are just ruptured blood vessels that are indicative of drowning. Evidence of injury. There is no evidence of fatal injury. Sparsely scattered contusions of various ages with colorations including green, yellow, brown, those stages of bruising, and various extensive fading as diagrammed. Look at the diagram at your own leisure. I'll link the autopsy report. Initial incision, the body cavities are ascended, through the standard wide incision. When we look at the neck, there's no abnormality, no foreign bodies. The hyoid bone is intact, the larynx intact, no hemorrhages, no trauma from the neck. We look at the chest cavity, pleural effusions are present, about 50 cc's bilaterally. Pleural fibrous adhesions are sparse, chronic, fibrous. However, basically the chest cavity is showing nothing more than his respiratory changes from his COPD and emphysema, remote surgical changes in the abdominal cavity, and no identification of the appendix, no ascites, which would we're looking for like infections or something going on there, and no peritonitis in the peritoneal cavity. Systemic and organ review is limited, but when we look at the musculoskeletal system, are remarkable, frameworks are remarkable, no fractures, muscles are fine, and there was mild to moderate osteophytic spine changes, which is probably just with age, like osteoporosis or something like that. But no lesions or anything like that. Cardiovascular system, basically the same, no aneurysm. Major branches were no severe arteriosclerotic abnormality. There was a little serous fluid in the pericardial sac, but basically it's just repeating what we already know, that he had some mild cardiovascular disease that did not require intervention at all. And this basically, you can read it, cardiovascular system, otherwise unremarkable. The respiratory system, also pretty much unremarkable. It just showed the anthracosis, the no PEs, no blood clots, and just showed the bullous changes from the emphysema, and of course the changes we see in COPD individuals. The gastrointestinal system, also unremarkable, basically just showed the same thing we've already talked about, which is the adhesions due to the remote abdominal surgery. No trauma, no necrosis, nothing that will contribute to his death. Hepatobiliary system, hepato is liver, biliary system is the gallbladder, and the tree that goes with that. But basically, unremarkable as well. The urinary system. The urinary system, for the most part, was unremarkable. What was interesting in the urinary system was the urine. The urine, they obtained 15 cc's of hazy yellow urine, and they did a preliminary drug screen on the card. At the autopsy, it was negative for ketones. That goes with diabetes. So he was not having any problems with diabetes. Glucose was negative. What was not negative was benzodiazepines. This is not put as a contributing factor, but I would like to say that they did contribute, the benzodiazepines, because he was positive for 2 benzodiazepines in his system. The genital system, prostate, not enlarged, no nodularity, testes and the scrotum, everything was fine there. The hemolymphatic system was also unremarkable. The endocrine system, unremarkable. Special senses, they were dissected. The middle ear was not dissected, so we don't really know, but probably unremarkable. Head and cranial nervous system, unremarkable as well. Spinal cord, unremarkable. No physical evidence collected at autopsy. Histologic sections are the tissue sections that are preserved in a storage jar, and their histological key is lungs. Just naming them. 1 had lungs, 2 had lungs, 3 had lungs, 4 had kidney and liver, and 5 is heart. The toxicology, they sampled the heart blood, the femoral blood, the gastric contents, the liver, the bile, the urine, and vitreous fluids, and they were submitted to the laboratory. And EDTA2 was also collected for blood typing. There was a special procedure where the nasopharyngeal swab was done for respiratory viral testing, and I could tell you that no viruses were detected. That is later on in the report. So that was also negative. Photography, photographs were taken to and during the course of the autopsy. Radiology, a CT scan was done. No fractures or unusual radial densities that would suggest anything like a cancer. Witnesses present during the autopsy was LAPD. The diagrams used, standard forms you could see for yourself in the autopsy. The summary and opinion, very important. Mr. Matthew Perry's cause of death is determined to be from the acute effects of ketamine, of which we discussed, acute effects. Contributory factors in his death include drowning, coronary artery disease, and buprenorphine effects. The manner of death is accident, and they put in the parentheses drugs and drowning related. The drugs and the drowning. The drugs caused the drowning, which caused the death. No signs of foul play are suspected. At the high levels of ketamine found in his post-mortem blood, specimens, the main lethal effects would be from both cardiovascular overstimulation and respiratory depression. What does that mean? Ketamine, oh, well, she might say it. Let's see what she says. Drowning contributes due to the likelihood of submersion into the pool as he lapses into unconsciousness. Coronary artery disease contributes due to exacerbation of ketamine-induced myocardial effects on the heart. So remember I told you that some of the effects, just look at them. All right. The acute effects of ketamine could be dissociative or out-of-body experiences. He may thought he was somewhere else. It would also increase his heart rate. It could decrease or increase his high blood pressure, but that's also dependent on environment and the person themselves of how it reacts. It causes cognitive impairment. It causes bad judgment. It can cause the inability to see as well as talk. It could cause fatigue, and it can cause loss of consciousness. Perhaps it caused loss of consciousness, and he became unconscious. Ketamine puts you into a deep sleep, right? He lost consciousness. Because he's in the water, he now drowns and dies. This is basically what the medical examiner is saying will happen. Because of his coronary artery disease, ketamine and coronary artery disease doesn't necessarily go together, but the ketamine was exacerbated or potentiated increased effects on the which caused because of his heart disease, the effects of ketamine was more induced and more prominent, if that's the fact. And the effect that the myocardial effects that ketamine has on the heart is to increase heart rate, increase blood pressure, all these types of things that it can have on the heart. So that's how that contributed to potentiate the effects. So if the effects would have been at 5, they potentiated them to be 10 or something like that. Buprenorphine effects are listed as contributory, even though they were not at toxic levels, so they didn't have to be there. But the additive effects, and remember I said buprenorphine or Subutex causes relaxation, drowsiness, whatever, sleep as well. So he already has a medication that could cause him to be sleepy and fatigued, and and then you put that with opioids. I also put in the benzodiazepine because, as you'll see later on in the report, he was positive for lorazepam, which is Xanax, and which means he had literally taken that in less than 24 hours. And he was also positive for 7-aminoclonazepam, which is the metabolite found in clonazepam. Clonazepam is generally, I believe, taken for anxiety. Lorazepam is taken for depression. So the metabolite was found. Clonazepam was not found. So he probably taken that a couple of days prior. So those additive effects of lorazepam or any benzodiazepine to help you relax as well. And sometimes people relax and go to sleep. That's an additive effect as well. So now we have 3 medications in his system that all contribute to him being relaxed and going to sleep, possibly with the added effect of him being in warm water that also helps us relax and go to sleep. And then the effects of him having cardiovascular disease and the effects of his respiratory disease, which caused respiratory depression because he already has trouble breathing because he has COPD and emphysema. These are drugs that decrease the heart rate. When you decrease the heart rate, you decrease the blood flow, right? It's not pumping as much. It's relaxing. So that means you have a decrease of oxygen, right? Because the heart flow rate decreases, the blood flow decreases, the oxygen travels through the blood. So now you have a decrease in blood flow, and now you're getting sleepy and you go to sleep. These people are how muscle relaxers work. These are how pain medicines work. They decrease the respiratory drive and you fall asleep. This is why so many people end up dead, because they get in a water source. His death could have been 1,000% prevented had he not been in the water. He probably could have just slept this off and got up and went on, even though as we're about to see, the ketamine levels were toxic. Autopsy shows no fatal blunt or penetrating trauma. Coronary arteriosclerotic disease is focally moderate, with a single vessel showing 50 to 7% narrowing. Heart is mildly enlarged. Lungs show emphysematous changes, edema, and congestion. No sign of acute respiratory infections, either by microbiology or microscopic examination. Toxicology testing revealed ketamine levels at a 35-40 nanograms per milliliter or 3.5 micrograms per milliliter in a peripheral blood source, and 3.27 micrograms in a central blood source in Mr. Perry's system. For context, in monitored surgical anesthetic care, levels for general anesthesia are typically in the 1,000s to 6,000 or 1 to 6 micrograms. Now, let me put a little bit more context into this. So generally, when you administer ketamine, it is done at 1 to 2 micrograms per kilogram. So in a 70 kilogram person, that would have been 70 to 140, right? His weight was 216. So 216 pounds, right? So his max dose would have been 1.96. How is that calculated? 216 divided by 2.2 would have made him a 98 kilogram person. And so he would have been 98 times 2 would have been 196. So his dosing would have been between 98 to 196. So most toxicity for ketamine starts at around 2 micrograms. But that does not mean just because you're over 2 that it'll kill you. That's not what we're saying. Because there are people that, as clearly you can see there, the range goes up to 6. However, when it is given in a medical setting by medical professionals, it is monitored. Ketamine is in and out real quick. Its effects happen within 3 seconds in a controlled environment. And the half-life of ketamine is about 3 to 4 hours or less, which means at 4 hours or less, but max we'll say 4 here, 50% of the drug that was administered is undetected. So if he took, well, we already know what he took. Well, we don't know. But let's say he took, and I'm going to give an easy number. Let's say he had 4 micrograms that was given. 50% of that drug was already gone. So now he's down to 2, right? And it doesn't work like in the next 4 hours, all of it's gone. So in the next 4 hours, it would be 25% more of that drug is gone. So it'll be a fourth of that's gone. So basically, in 8 hours, 75% of the drug is gone. In 12 hours, 87%, a little over 87% is gone. So that's how it works. It's like 1/2, 1/4, 1/8, 1/6, 1/32, 1/64, 1/28. And around 1/28, that is when it will pretty much become negligible or not detected. So that being said, because this is detected and we know the half-life of it, there is no way this ketamine came from an infusion a week and a half ago. All right. So I just want to put that a little bit more in perspective for you. Also detected was, we said the buprenorphine, which is an opioid-like drug used in the treatment of opioid addiction, as well as acute and chronic pain. The levels was therapeutic for the drug as well as its metabolite, norbuprenorphine, which is 8 and 17 respectively. Now, that's important even though the opioid was not at toxic levels, it still contributed, right? Because the additive effects or the side effects of the medication, right? Non-toxic levels of benzodiazepine. Okay, she did mention it. Non-toxic levels of the benzodiazepine lorazepam were detected. Also, the metabolite of clonazepam, 7-aminoclonazepam, was detected. Clonazepam, however, was not detected. And remember, I told you the side effects of that. So that's also additive to me, even if it's not mentioned. Alcohol, methamphetamines, cocaine, heroin, PCP, fentanyl were all not detected, which means they were negative. Ketamine is a dissociative anesthetic with established human medical and surgical uses. Also, it is used in recreational drug use and other illicit settings, mainly due to its dissociative nature, indicating disconnection of mind from body. So that dissociative effect, disconnecting mind from body, let's say he had that. He could have thought he was swimming and drinking water and really he's drowning. That's the worst case scenario, that if you're dissociated and, well, that's kind of okay. He doesn't know he's dying, right? Or something like that. It can also have short duration hallucinatory and psychedelic effects. This latter effect explains why it's used in nightclub parties, rave culture. The exact method of intake in Mr. Perry's case is unknown. There were trace amounts of ketamine that was also detected in the stomach context. He was reported to be receiving ketamine infusion therapy for depression and anxiety. Per the medical examiner investigators report, his last known treatment was 1.5 weeks prior to death, and the ketamine in his system at death could not be from the infusion therapy, since ketamine's half-life is 3 to 4 hours or less. I'm going to comment on something once more, but I'm going to keep going. These are the diagrams. You can look at them on your own. I wanted to look at, not this, here. And I don't know how to blow this up, guys. But anyway, this is best I can do right now. When you look at the drug screen, the first one says alcohol. There's nothing detected there. And I think it's PP that means it's present. ND means not detected or negative. INC, you'll see, is inconclusive. So in the drug screen in the heart, you see benzodiazepines present. When you look at drug screen confirmation, you see blood femoral, ketamine, and non-ketamine is present. Ketamine has a level. Blood in the heart, you see, I thought it was interesting that, well, they say he didn't smoke anymore, but there was a prescription for bupropion, which is given as a smoking cessation drug, and it will not detect it, so I guess he wasn't taking it. However, ketamine is present, non-ketamine is present. Quetiapine is, I believe it says inconclusive, but then quetiapine metabolite was present. Okay, that's Seroquel. This is a drug that is generally given in schizophrenia, but it's also used for sleep, I believe, and bipolar depression. The metabolite is found, which means he clearly was taking that, right? The side effects of Seroquel: dizzy, drowsy, confusion, difficulty concentrating, excessive sedation, and respiratory depression. So that is another drug in his system that's causing him to possibly go into a deep sleep, right? Ketamine, non-ketamine present there as well. This is in the heart. And the 7-aminoclonazepam, the metabolite, clonazepam, non-detected. Benzodiazepines, lorazepam, detected. And the others are outside tests that were done. Stomach contents show ketamine level, non-ketamine is present. And this is important in the fact of, what was I going to say? to see that all of these medications that he was taking that causes a sedative effect. When you're going through this, also just to point this out, when you look at the patient test report, it says his potassium level was high. That's very important, high, but I believe that's just because potassium spills out in the blood. I don't think that's significant. These are just the findings of the respiratory swab that showed there was nothing there as far as a viral infection. This is just his information, I believe. But looking at this report, like I said, I believe it could be, he could have totally, even with all this in his system, survived had he not been in water. If he'd have lost consciousness, he wouldn't have drowned if he was in the bed, if he was on the couch or anything like that. It's the drowning that killed him because of the effects of ketamine that were more than likely potentiated by him being in that water source, and even worse, being in warm water, and the fact that he had those other medications that were contributing. Because even with all that, I think he'd have been okay. Like I said, if he just had not been in the water source. So that's what we say accidentally could have been preventable. The takeaway from here is to stay out of water when you're taking medications that have sedative effects, right? And this is why a lot of celebrities end up dying. But even youth, when you're in warm water, I've heard lots of people say, oh, I took a muscle relaxer, I did this, and I got in the tub, and I couldn't lift my arm up, and I couldn't get out, and I was trying to scream for help, and I couldn't, because it relaxes your muscles, it potentiates those effects, right? You can't talk, you can't scream for help if nobody's checking on you, and sometimes the weight of the water is so heavy, you can't lift your arms up because you're so weak. And the worst case scenario is that if Matthew Perry were aware and he did not lose consciousness, because people love to say, well, if you fall asleep and once the water hits your face, you'll wake up. That sounds great and all, but that generally doesn't always happen. But here's two things that happen. Number one, head submersion can cause shock, okay? And that can cause a whole bunch of other problems that kick off in the body and you still drown. And second of all, worst case scenario here is that he did not lose, that the water did awake. Let's say he was aware that something was going on and he couldn't get out the water, and he couldn't scream for help because he couldn't talk. He was wide awake. He knew he was drowning, but he could not get out of the water. That would be terrifying to know. And we hope that that's not what happened, right? We tell a different story of say, oh, he lost consciousness and then, he wasn't aware, but he could have possibly been aware. And so that's the take home point that I want you guys to know. Stay out of water if you're going to take medications of this sort, whether it is prescribed or not. There are a lot of more takeout points that I'm also concerned about on his reporting. It lists that his I didn't go over this, and I don't want to make this too long, but we'll look at this. But also on his report that it listed his primary care physician as anesthesiologist. I thought that was quite strange. I hope that I got a lot of questions about that. He also was seeing a psychiatrist. I have questions about his surgeries that he had. Was he using those to get other medication? And where was he getting all these medications from? Were they street pharmaceuticals or were they being prescribed to him? We have these listed here as being prescribed. That was interesting. He's on Mounjaro as well. And what are the complications of him on all these different medications? Metformin. We know metformin could cause a decreasing his glucose in the wrong settings. It generally doesn't do that by itself. He was on, I thought interesting as well, tadalafil and sildenafil. That is Viagra. So, yeah, hopefully he didn't have any of that in his system. We don't really know. But there was some medications that he was described here to me that seemed kind of possibly contraindicated. But you have to have a hub, and that's where your primary care physician is supposed to come in at, to know what all is being taken. That is the importance of having a PCP, to know who's prescribing what, right? And going to the same pharmacy and being able to pull up all these drugs, and for the pharmacist to say, hey, I know such and such wrote you for this. The nephrologist wrote you for this, but this counteracts with the medication that you're already taking, instead of going to 14 and 15 different pharmacies, correct? Especially if they're not in the same network. You might go to a private pharmacy here, you go to Walmart over here. It's okay if you go to Walmart at another state, but if you go to CVS, now they're not linked together, correct? Most PCPs are family and internal medicine trained, not necessarily anesthesiology trained. So I find that very interesting, of him getting his hands on this type of medication, and not necessarily for blame or anything like that, but definitely for education of, hey, we need to possibly do a little bit more tighter grip to help people save themselves. We have seat belts in there to help you protect yourself, right? We can't force you to put it on there, but it's in the car because we know that they save lives. So even as adults, there are things that are put in place to help us protect ourselves. And that's all I'm saying. I hope that there is an investigation into going on to see exactly what was going on, and were there warnings given. It's very important when we write these prescriptions, that we tell people, hey, don't do this, don't do that. This is what you look for, and things of that nature. Side effects is very important. And educating your patient on the medications they're taking, their genetic, their medical history, the environment, because that played a very significant part. His medical history of coronary artery disease and the environment he was in. His environment is what killed him for the most part, right? He had the medication that he was taking, which he could have been fine with, even with his genetic history possibly of coronary artery disease, but the environment that he placed himself in to possibly relax, harmless, but getting in that water source cost him his life. Okay. I hope you guys enjoyed this. I didn't mean for this to be this long. When I practiced it before, I was like, it's only going to be around 20 minutes, and it ended up being like an hour. But I hope you find it informative. If you like it, let me know. We're going to try to cut it down going forward. This was my first time. And if you have any questions, please let me know. Put it in the comments. And remember to like the video, share the video, subscribe, and we'll see you next time. Bye.